Mainstreaming recovery, of course, is something which many people will be quite wary of. Many critics of the British drug strategy over the course of the last 3 years have felt a degree of mistrust in terms of those people who are responsible for putting in place drug strategy. And so we'll be very wary about something like recovery, which is, in many people's lives, a very personal, profound force becoming mainstreamed or bureaucratized. But we need to have, if you like, recovery available to every single person passing through treatment, irrespective of the judgments or prejudices of people who feel that some people just can't aspire or hope ever to have recovery in their lives. In that sense, recovery does need to be mainstreamed. But there are quite separate strands of recovery thinking and philosophy which need to be entwined in a successful mainstream orientation rather than simply ironed out flat. I mean, there's a very strong move within British drug treatment at the moment for abstinence-based recovery, and this has been one of the most powerful voices over the course of the last 3 years. And many people who have no immediate contact with drug dependence would imagine that recovery from drug dependence could involve nothing other than abstinence. And that's one very important strand, I think, which has to be incorporated and respected and advanced. Another strand, which comes from a slightly different source, is a more personalised view of recovery. And those of us who've had any contact with the emerging transformation in social care will understand that this has its roots in learning disability, in mental health, and is above all keen to endorse a view of recovery that stresses that it's a very personal journey, and that irrespective of how you seek to measure it and assess it, it should in the first instance be wholly owned by the person whose journey it is. So that's another personalising strand of recovery which, although it hasn't perhaps had quite such a forceful voice in the challenges and debates of the last 3 years, is nonetheless important going forward, because I think not everybody is ready or keen to embark upon an abstinence-based journey, but want recovery nonetheless. And for some, particularly those with complex needs, they need to be able to accommodate recovery to their needs in a way which suits them. So I think personalised recovery journeys are something which the field has to take very much to heart, even though it's not necessarily immediately apparent how we will measure progress, for instance, or how we will train the workforce in order to co-produce these recovery journeys. So personalising recovery is an important strand as well. Actually, the third strand of recovery, which I call mainstreaming recovery, is, if you like, the approach that the mass of the workforce has to learn to take in order to meet those standards and those outcomes and those expectations which the public, who after all are paying for drug treatment, expect any treatment to have. So mainstreaming recovery, for instance, will address all those things which have made drug users and people dependent on drugs reliant on the state in ways which many people feel is inappropriate.